take care of the sickest babies in the province, and our respiratory therapists help the Janeway children breathe.
I'm the division manager for the emergency room, the PICU, social work, and psychology.
Labor and delivery is where we deliver babies for Eastern Newfoundland, Labrador, and also for the province. We take all high-risk pregnancies, and so we deliver about 2,200 babies a year. And our maternal fetal assessment unit helps treat any high-risk pregnancies that come through.
I'm the division manager for Janeway Perioperative, which includes pre-admission clinic, the OR, surgical daycare, recovery. It also includes pediatric dentistry and pediatric complex pain. So my departments see patients through their journey of when they need surgery, from the before, the middle, and the end.
So the emergency room is usually when someone comes in through and is in crisis and has to be managed. Oftentimes they go through to the ICU and are cared for there. Our social workers are part of an interdisciplinary team that is involved with our patients from the time that they come into our PICU, and they follow them straight through until they complete their treatment or they are discharged from hospital. Our psychologist, Dr. Hubbard, she does a lot of work as far as being able to help a client deal with the process and the illness of which they are experiencing, whether that be a cancer diagnosis or a trauma diagnosis or a long-term illness, and adjusting to new medications and things like that.
One of the challenges between the NICU and the respiratory department is to continue to provide cutting-edge care.
As new staff come through our department and as changes in guidelines for care of these patients, education will always be needed here. We've always used it a lot, but it's even more now, but we will always need that.
The Janeway is seeing clients who are presenting with very complex health issues. And we need to ensure that our staff have the knowledge to support our clients as they go through the Janeway.
We've got to say a big thank you to all the people that have contributed and for their ongoing support as well. In the NICU, the donations have focused on family-centered care. We've really tried to help families feel comfortable at their baby's bedside and help them feel supported during their time here. For the respiratory therapists, we've invested in some equipment that helps our department learn.
Your donations do a lot for our departments. It provides high-end, current technology and equipment that we can utilize to help deliver the safe care that we do.
Thank you for all your contributions. They've greatly impacted our ability to provide care and service to our patients through increasing access, better technology, and increase in the amount of instruments we have available for pediatric sizes. Also maintaining our current status and quota of what we have, since a lot of it's specialized and it's smaller, having more than one, so we can increase the access, but also it gets worn down when we only have one or two, so we need to keep replacing them to make sure we can keep availing of certain services.
I work with a multidisciplinary team that really cares for the babies that are in the unit, and that's what really drives us.
What gets me out of bed in the morning for my job is the positive stories and outcomes we have for families and being able to support families through sometimes the most difficult parts of their life.
The best part of being a labor and delivery nurse, I believe, is being in that moment with families and seeing the baby on their very first birthday. It is the best feeling in the world.